So this is a really exciting time at AgeOptions. We've been able to develop some new programs that have really been able to serve clients in a new way. And AgeOptions is uniquely positioned to innovate in a number of sectors, in part because we're an area agency on aging. By doing that, we're able to identify needs in the community and see where there's gaps in services and work with community partners to fill those gaps in services. We started forming Caring Together, Living Better when we saw that it was so important to engage the faith community in caregiving and to make that connection between the Caregiver Resource Center and the faith communities.
Most people didn't want to identify themselves as caregivers because they were caring for loved ones. And so they felt that caregivers was a title that would be for somebody who was paid. And we explained to them the moment that you are with somebody that is in need, even if it's a loved one, you are caring for them. You also, as a caregiver, need your space, need your time. One of the programs that we started for the caregivers was a painting evening class.
And the painting, it was like therapeutic for me. I felt free and it was relaxing. It took me to another place.
Our work with peer mentors and developing the peer mentor program has been an innovation that we're particularly proud of at AgeOptions.
The peer mentor program is a group of individuals that go out into the nursing home to speak to residents and encourage residents about transitioning out of the nursing home back into the community.
To have the stories of somebody who successfully moved and to have them tell their stories was really powerful in helping them open up a world of opportunities.
And this program says your life is not over, whether you have family or no family, because the program can provide for you the supports you need to be successful.
I became a peer mentor because I like seeing the look on people's face when they went from anguish and stress to relief and calmness. After we talked to them and told them what the whole program was about, I could see it in their face. They felt a lot more reassured that they could do this too.
So Make Medicare Work is one of those innovations that give professionals the tools they need to properly serve in the midst of a time of incredible change. And we've seen that over time, those changes continue to become more and more dynamic and different.
We work very closely with the Make Medicare Work Coalition, and they really help some of the providers like ourselves understand what's going on a larger level so that we can help the consumers be more informed. But also Make Medicare Work's been really, really helpful in times when we have difficult cases or cases that are a little bit atypical. They have been really helpful in helping us advocate on a higher level for those particular patients who need that help.
In my 9 years here at Rush, what I've noticed is a pretty significant evolution from the way healthcare approaches what happens in the community. I'm seeing area agencies on aging, like AgeOptions, really taking a progressively larger role in the treatment of patients after the inpatient hospitalization. And from that perspective, our partnership with AgeOptions has really been one of the very first in the country to demonstrate what's possible when the community and hospital really comes together. What we've been seeing time and time again is our patients really struggle with understanding insurance. The actual complexity of Medicare is sometimes so overwhelming that patients and even caregivers that are part of the healthcare setting, sometimes they are physicians or nurses themselves, don't know how to navigate this. Make Medicare Work is an incredible initiative that helps the patients to really navigate this puzzle in a meaningful way.
The partnership between Rush and AgeOptions is really particularly important for me, and I have nothing but the most wonderful things to say. I've referred a lot of my colleagues with advocacy-based questions that we have around Medicare, and it's been truly invaluable. So people are probably sick of me talking about it.
Take charge of your health is an important innovation that AgeOptions has really grown over time. It started as a small program where we were able to serve something like 100 people a year, and now we're serving over 1,000 people on a statewide level.
Having offerings like chronic disease self-management is really critical so that your health can be maintained after you leave the hospital.
Many of our clients come to us with very low incomes or an income that would be considered low by most people's standards. So they come with anywhere between $900 up to $1,200. I just had a lady tell me, wow, I wish I would have known about this 15 years ago, because she's in her 70s already, has had this income since she was retired and just never knew that there was anything out there for her. So it's really powerful to help somebody see that there is this assistance and know that they have somebody who can advocate for them and help them with these applications.
And a week ago, I had a serious issue. Bailey called as a follow-up, and I was crying. She talked to me as though she was sitting right next to me, like holding my hand. I was able to laugh and feel good about myself. And that doesn't happen too often in this day and age. You're a godsend. This agency is a godsend.
We are here to help older adults live as long as they can at home, as happily as they can. Whether that means connecting them with in-home services, helping them financially, or helping protect them from fraud.
I'm much smarter than I was 3 years ago. I want to be an advocate for AgeOptions because I know my stuff now. I have words. Bailey gave me my words.
I do it because I love older adults. I love being able to connect them with this network that we've built, and I think that the impact it has on not only them but their families and the community is huge.